Hi there, my name is Lori Milsick. I just recently had a discussion with Dr. Suzanne Yoder, an audiologist. She gave me a lot of information I'd like to share with you today in this blog. So we'll be talking about the meaning of audiology, different kinds of audiologists, the educational requirements for audiologists, and comparing audiology and medical doctors. While you're watching this vlog today, maybe you'll have a comment or a question or ideas for another vlog. Let us know through comments. Audiology is the study of hearing and communication disorders. Audiologists are trained to diagnose hearing disorders of all types and formulate treatment plans for solutions that meet the patient's needs. Audiologists are trained to implement many of these treatment plans as well. Audiologists are not medical physicians and therefore do not provide treatments like surgery or medication. An audiologist is trained to determine if a referral to a medical doctor is required. An audiologist can provide solutions for hearing loss that cannot be cured by medical intervention. Here's a list of things an audiologist can do for you. Since audiology is such a diverse profession, audiologists can be found in many different places. The medical audiologist. This audiologist works in hospitals and other medical facilities. This type of audiologist will focus on medical-related hearing disorders. They typically work in a team alongside other audiologists, ear, nose, and throat physicians, otologists, neurologists, surgeons, other medical physicians, nurses, physical therapists, occupational therapists, and more. This team can also include a speech pathologist as well. Medical audiologists can be found in the clinic, assisting with appointments, in the operating room, assisting with surgeries, and even in the maternity ward, providing newborn screenings. Medical audiologists see many types of patients and perform lots of different duties, including hearing tests, activation and programming of implants, hearing aids, newborn hearing screenings, and more. Medical audiologists might see patients of any age, but some will specialize in pediatrics, newborn, or adults. Some may specialize in cochlear implants, and others may specialize in certain disorders such as tinnitus or auditory processing disorders. The military audiologist. Audiologists can be found working in the military and in military facilities. Military audiologists join the military as well. They may be found at military bases or military hospitals around the country and even outside of the country. They perform the same role as a medical audiologist, but some will focus solely on hearing conservation and hearing protection for soldiers. The educational audiologist. Audiologists can be found in schools. These audiologists work with school-age children to assess needs in the classroom and provide additional support for hearing and communication. Audiologists work as a team alongside teachers, school administrators, other audiologists, speech pathologists, and parents. They will attend meetings for IEPs, write supporting documents for children to obtain the services they need in school, and they focus on classroom hearing. That means they work primarily with assistive technology, such as FM systems, microphone systems, and hearing aids, and implants that students tend to wear. Educational audiologists are often mobile and will cover multiple school districts within one area. The industrial audiologist. Audiologists can be found in industrial complexes. These audiologists focus on hearing protection and training workers about the harmful effects of loud noise. They work with wellness directors, nurses, OSHA compliance directors, and others. They will do hearing screenings and make hearing protection. They also provide classes about hearing conservation. The private practice audiologist. An audiologist that works in private practice can be located anywhere in the community. They can be in small offices or large ones, and they can work alone or with other audiologists or a team. They typically will focus on treatments for non-medical hearing disorders, but that's not always the case. Private practices may have contracts to see military patients, do industrial work, or provide education at various sites as well. Sometimes private practice audiologists collaborate with local physicians and work in medical facilities as well. The research and academic audiologist. Audiologists are also teachers and researchers and can be found in universities. They study areas of hearing and communication that are not well understood. They conduct research, publish articles, and teach. There is one other, lesser-known specialization called animal audiology, which studies the hearing loss of animals. These audiologists may work alongside veterinarians, and they often assist with service animals such as police dogs or horses. Educational requirements for audiology in the U.S. include graduating with a doctorate degree. A person interested in becoming a clinical audiologist first earns their bachelor's degree in communication science and communication disorders, and then earns their doctorate degree in audiology, usually the AUD, not a PhD. Altogether, an audiologist requires 7 to 8 years of college. An academic audiologist that's interested in research usually obtains a PhD, although some academic audiologists have other types of doctorates. Completing a PhD or a doctorate degree requires an additional 2 to 5 years of study. An audiologist is also required to obtain 2,000 clinical hours prior to receiving a license, which will take approximately 1 year as an intern. Once licensed, an audiologist must maintain their education by attending classes for CEUs, or continuing education, and provide proof to their state every year. Some audiologists will become board certified as well, although that's not required. Those audiologists are required to take specific types of CEU classes called evidence-based, and ethics training is a requirement as well. Audiologists differ from ear, nose, and throat physicians and otologists in several ways. The audiology degree is clinical, not medical. Audiologists do not train to do surgeries or provide medical procedures. Audiologists study more about communication issues and how to meet patient goals for hearing better and communicating better. While physicians have training on how to resolve medical issues, but they're not well trained in the communication respect.